We're going to go now to a developing story. Former President Joe Biden diagnosed with cancer. Here's what we know so far. It's an aggressive form of prostate cancer. It has spread to his bones, and the announcement follows a recent prostate exam after Biden reported increasing urinary symptoms. Doctors finding a Gleason score of 9. The cancer is hormone sensitive, which doctors say allows for effective management and treatment. Right now, there's no timeline for treatment. So this news has many Americans wondering what this means for his health and what kind of treatment he may need. Here to discuss that diagnosis, our chief health editor, Dr. Nandi. And Doctor, people have been wondering about how serious this is.
Yeah, pretty shocking when we heard it, right? So this is very serious. While most prostate cancers are highly curable, President Biden has been diagnosed with what's called metastatic prostate cancer, which means the cancer is spread outside the prostate, and in this case, to the bones, and this is considered an advanced stage, and so it's harder to treat, and it's not curable. And what's more is that his Gleason score is 9, and we use that Gleason score to grade prostate cancer, and it's based on how the cancer cells look under the microscope. It ranges between 6 and 10, so 9 is a high score, means the cancer is very aggressive. But there's some good news, right? The cancer appears to be hormone sensitive, and that means that there are treatments that can slow it down.
So can you talk to us about what treatment may look like for the former president and what the prognosis looks like?
Yeah, absolutely. Good questions, right? So President Biden will likely receive hormonal therapy, and it's a treatment that either blocks testosterone or stops the body from making it. So prostate cancer cells use testosterone to grow. So cutting off that fuel can slow the cancer down or even kill some of the cells. Now, surgery and radiation are usually not good options at this stage, but doctors may also have targeted treatments or chemotherapy depending on how well he responds. And even though his cancer is advanced, there are newer therapies and are showing strong results. Now, the question of our prognosis, every patient is different, but many men at this stage live 4 or 5 years or sometimes even longer. I do want to mention that prostate cancer is super common and often does not cause any symptoms at first, but here are some signs to look for. Number 1, trouble starting to urinate, a weak stream or stopping and starting, going to the bathroom more often, especially at night, burning or pain when urinating, blood in your urine or semen. If you notice any of these, please talk to your doctor right away. The American Cancer Society recommends that men get screened at age 50, but if you're black or have a family history, you should start at age 45. Remember, when it's caught early, prostate cancer is very treatable, but it's still the second leading cause of cancer death in men. Too high in my opinion, but it's a very serious diagnosis, and there are options, and with the right care, men like our President Biden, can still live with purpose and stay active for years. So I think this is a call to action for people to look at and see if you have any symptoms and get screened when they need to.
Yes, because you've got to be progressive about it. And
exactly, and catch it early and get it treated. But thoughts and prayers with President Biden and his family.
All right, thanks a lot, Doc.
My pleasure, of course.
If you have a health question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or X. We'll get it right to him.